What are perinatal mood disorders?
So perinatal means the time before and after childbirth. And so it can happen, these things can happen when a woman's pregnant, and they can happen postpartum as well. And there are more than just postpartum depression. There's postpartum or perinatal OCD, which is obsessive compulsive disorder. There's perinatal PTSD, which is trauma-related generally. It's a post-traumatic stress disorder. There's anxiety, there's depression, there's perinatal psychosis, and then there's bipolar. The baby blues generally occur in 80% of the population, so it's actually it's a normal occurrence, and it generally occurs within 2 weeks postpartum. And it's a lot of mood swings, a lot of teariness and laughing and just feeling overwhelmed, but that's a normal adjustment to a large event in someone's life, and they usually subside within 2 weeks. Now, like postpartum depression occurs after that, and it is longer term.
What are some of the biggest misconceptions about perinatal mood disorders?
A lot of people just are not informed about it at all. They've heard of postpartum depression, and they think that that's the only thing that can occur, and they lump everything together. And so a lot of times women have heard stories about other women who've had what is generally a postpartum psychosis and have done something like killed their child, and they become really anxious that that's something that's happening to them, and so they're afraid to even talk about the feelings of depression that they're having, because they're thinking that they're actually going to do something to hurt their child. So that causes people to not talk about it. So
what should a woman do if she's experiencing what she thinks might be a perinatal mood disorder?
Really, the best thing to do is to reach out and find someone to talk to who's got some information, accurate information about the mood disorders. I volunteer for an organization called Postpartum Support International. That organization has volunteers in every state that can talk to women about what they're experiencing, help them figure out what it is, and help them get in contact with other resources. A lot of times family members will recognize before the woman herself recognizes that something's not quite right, if she's just not dealing with things as well, and it's continuing, it's ongoing, it's beyond the 2 weeks, and things are still not falling into a routine, and she's really, the thing about depression is that there's so many different ways it can present. Someone become very moody and sad and can't get out of bed. Other people become very agitated and snappy and irritable, and so it can present in different forms. So generally I'd say if someone is not acting like themselves and is really struggling, then that's a time to come in and get, and usually a professional is the best to do a diagnosis if someone is struggling, to figure out, to tease out what it is that it actually is occurring for that woman.
Tell me more about the actual assessment that's the universal that professionals go by.
For postpartum depression, we use the Edinburgh Postpartum Screening Scale. It's just a 10 question scale that is you can access it online. Anybody can do it, and each answer is given a numerical value for the weight, and then at the end you add up all the numbers, and if you're over a certain number, then you need to be evaluated by someone. But anybody can do that, which is really helpful. The health department does it regularly with the women that they're visiting in the home, but you can just look it up online.
What are some resources for women and families?
Again, there's Postpartum Support International. They have a website that has a ton of resources and information, and then they also have volunteers in each state so that you can contact them specifically to get information on resources in your particular area. But one of the best things that you can do is find social support, and so talking to other new moms is really helpful. So I recommend finding any sort of new mom group as a first step, so that women have the opportunity to talk to other moms who are experiencing this huge life-changing event for the first time.
Is there anything else that you would want people to know about perinatal mood disorders or the supports that are out there for people who are experiencing them?
I would like people to know that it's more common than you think, that the adjustment having a child is huge, and that it takes its toll, and it's not to be afraid to reach out to other people and to talk to them when you're struggling, because you might discover, and you're likely to discover, that a lot of other people have had difficulties as well. It's something that a lot of people don't talk about, and so it's kind of a secret, and we don't need to keep it a secret. If everyone is talking about it and helping each other, then the adjustment goes much more smoothly.